Dr. Donald Hohman, orthopedic surgeon with the Texas Orthopedic Associates in Dallas, Texas. I'm a board-certified, fellowship-trained joint replacement surgeon. I specialize in joint replacements of the hip and the knee. We spend a lot of time talking with patients about how to best be prepared for surgery. And when it comes to joint replacement, some of the things that we try to spend a lot of time with patients discussing or some of the risks around joint replacement. For example, patients that are generally not healthy. So oftentimes people that are in need of joint replacement, they can be people that have some medical issues that maybe are not well controlled. For example, diabetes, or if patients are overweight, we work with them to get them to a safer goal for weight loss. And all of these things help tremendously with minimizing the risks of problems after surgery. And it also makes their rehab a lot easier. It's easier for them to get up afterwards. Now, very commonly, patients will say, look, how am I supposed to get out and do things when I have I tell them, well, you have a flat tire. It's hard to get around when you have a nail in your tire. And so we work with them to help, sort of illuminate some of the options that there might be for them to increase their activity without putting a lot of stress on their arthritic hip or their arthritic knee. Patients that are smokers are something that we spend a lot of time talking with people about, because that is a very dangerous risk factor around the time of surgery. And in fact, we have to draw a hard line oftentimes with patients who are smokers because it's just too dangerous to consider a major reconstructive procedure with somebody who continues to smoke. So we try to optimize all of these medical conditions. We try to help them avoid some of these things that can lead to issues at the time of the operation. And we try to help them stack the deck in their favor so that we can get them safely through a big operation and minimize the risk of having any problems.